We'll have a moment of silent meditation and pledge to the flag. Thank you. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. I'd like to call to order this special meeting of the Monongalia County Commission. We are at, not on the 8th,
Mr. Chair,
on the 13th.
I'd like
Yes.
to move the agenda so the comments from the public will be after the new business item.
Second that motion. All in favor?
Aye.
Okay. So that you understand, public comment will be at the end of the meeting rather than at the beginning. We have to include that. I will remind everybody here, this meeting right now is being live streamed. It's also recorded. It will be up on YouTube. So when you're choosing your words, let's choose them wisely. The discussion is of one order, and that will be the consideration of recommendations to the governor for action in regards to the current status of COVID-19 in our county. It's unfortunate that we have been singled out, and we have been given this opportunity to at least present to the governor a possible plan of action rather than having the state dictate it. So, that being said, I ask everybody, I will be going down through here to give people time to speak, but regard your time. I'm setting the time limit on this meeting at 1 hour and 15 minutes. If it can't be achieved in 1 hour and 15 minutes, then I'm sorry, we're wasting time. So I won't have anybody speaking to hear themselves speak. If you begin to meander from that, I will say to the point. If you still meander, I will say thank you, and that will be the end of that particular speaker. Okay? Everybody understand these basic ground rules?
One
Yes.
point of order, Commissioner Sikora is participating by phone.
Yes.
Yeah.
Yes. I did actually say that both commissioners are here present, and Commissioner Sikora is participating by phone. Okay? So, we'll begin this discussion. Tom wishes to speak briefly, and we'll let Tom speak, and then I will then hand the discussion of the meeting over to Dr. Smith.
Thank you. I want to thank everyone for attending today on such short notice. What I wanted to do was recap how we got here today. On Friday, the governor called out our county for our high spike in positive numbers. These numbers were not because of more testing, but because of social contacts. We had gone from 145 tests on June 30th to now I have to change 525 tests yesterday. He stated that he would consider taking some immediate steps if the numbers over the weekend continued to grow. Well, the numbers did grow. I reached out to the governor's office with the support of the county commissioners on Friday to ask if he would give our county the opportunity to meet on Monday with all elected officials as we have here, and I do appreciate everyone being here, and Dr. Smith from the health department, so we could develop a plan. His office agreed to listen to what our recommendations will be. The purpose now is to speak as one voice, representing all the government bodies on how we want to address the pandemic spike and what we can immediately do to slow down this virus, protect the citizens of our county, continue to keep open our businesses in a safe manner, and prepare for the opening of schools, both public and WVU. The only way to accomplish these goals will have to be that the community must be on board. We must have them understand that it is their responsibility and their ownership. Thank you.
Thank you. Well, now I'll turn this meeting over. I will retain the gavel, but Dr. Smith, you're now in charge for your presentation. Thank you.
Thank you, and welcome everyone. It's unfortunate that we need to have this discussion, but it's important that we do and try to formulate a good plan coming forward or moving forward. And so, just to review, as of June 30th of this year, Monongalia County had a total of 160 cases, and that was since the beginning back in March. And at that point in time, starting July 1, the numbers started increasing, and we were getting 30 and 40 new cases a day. And as of yesterday on the 12th, we had new cases, not the 160 original cases. We had an additional 350 cases. And so a total for Monongalia County, all included, is over 525. And as I walked through the door this morning, I was given a list of 10 additional cases that had come in. Now, over the last 2 days, both in Preston County and in Monongalia County, there was testing available, and certainly with the added interest and concern, there were over 3,600 tests done. And many people that work in Morgantown live in Preston County and vice versa. And so as those results start to come in, I'm not sure what the percentage will be, but they will certainly uncover a lot more positives. So looking at the breakdown of those numbers is that if you take the 18 through 29-year-old group, that's 75% of the new cases. So we're dealing with not the previously observed group of nursing homes and the elderly. These are young people, much more mobile. And when we have a positive case, we are required to do a case investigation. So we open up a folder, if you will, and we talk to the individual, get their background. Do they have pre-existing medical problems? Where were you? What were you doing? And we have to go back 48 hours. Now, that's a challenge. I couldn't tell you what I had for lunch yesterday, and so we want people to tell us who they were with in their social circle for previous 48 hours from the moment that their test came in, so that we try and capture everybody, because we know that this disease, people shed a lot of virus before they become symptomatic and before they get tested. And so then that's called the case management or the case investigation, and then off of that we make a contact list. And so I had dinner with this person, I had a business meeting with this person, I went to the store with this person, and then we try to notify all the contacts to let them know you've been named as a contact for somebody who tested positive, and therefore, because you've had direct association with this individual, you need to quarantine for 14 days. And if at any time during that period of time you become symptomatic, you need to be tested. And so that is a challenge. And the longer that we do this, the more less polite people have become, and we will be working with various social media, print media, news media to try and reiterate that expect a phone call from the health department if you're the positive or for your contacts, and that we're required by law to do this. Anyway, that's sort of where we are. We are seeing the vast majority of these younger people having a common denominator of not observing social distancing, not wearing masks, and those two elements right there seem to be the common ground for why we have now begun to experience such a wildfire of cases. So it is widespread community disease. Now, previously, the state would say if you had 3 or more cases from an individual location, that would be considered an outbreak. Whether it was at a gymnasium or a restaurant or a bar or wherever, that would be considered an outbreak. But because of the numbers that we are experiencing, the state has now designated Morgantown as an outbreak because we have such widespread disease. As a result, there is talk in Charleston of how to control this. And Commissioner Bloom is exactly right that if we do not take steps to try to bring this under some form of control, it will be done for us. Mm-hmm. And my personal concern as the health officer is that, one, we support commerce because we see that's the lifeblood of the community. If the governor takes the position that they close all restaurants and bars, we have lost any opportunity that we have to work with business owners, proprietors, and managers to help us control this. Because it will just generate house parties and backyard barbecues and places that we do not have authority to intervene as a health department. So we see the importance of working with existing businesses to try to develop a plan so that we can control this. And we have several steps to the dance, if you will. And so the proposed plan that we are putting forth has been discussed at the governor's office, the cabinet secretary, the county commission is aware, board of health is aware, chamber of commerce is aware, as many people as I have been able to get. And it's sort of a three-stepped process or a phased graduated approach to trying to control this. So we're going to use the three-person format because it's something we're familiar with and there's some science behind that. So if a restaurant bar business has 3 people, moving forward, not going to go retrospect, but moving forward, if we have 3 people that are testing positive and have been in an interaction at a particular business, then that business will be required to close, undergo a deep cleaning, and then an inspection from the health department, and then reopen. If an additional 3 people following that closure and deep cleaning occurs, then that entity would again be required to close, have a deep cleaning, and undergo a quarantine period of 14 days, which we put on people all the time. So that 14 days is not out of order with anything. And then another inspection, and then they can reopen. And if there is a third event where they've had 3 close, 3 close, and then 3, then the business would be closed until the numbers in the county begin to improve and it is deemed that it is safe for that business once again to open up. That plan has been given the nod from the Cabinet Secretary Bill Crouch and others that would be sort of a basement, a minimum, if you will, and I would suggest that that's a good place to start, that has been sort of, for all intents and purposes, had all the approval except a signature, and I would like to start with that, and then I'd like to invite this as an opportunity to how we may improve or embellish that minimum standard to focus on specifics in our community. Thank you, sir.
Thank you. Okay, I am remiss in that I did not allow Commissioner Sikora to speak. So if, Sean, if you have a word that you would care to add, I did allow Tom to speak. Would you speak now?
No, I appreciate Dr. Smith and his staff working towards this in such a quick, short period of time. I do want to say that we're here to work this through and work with him and any changes that we may suggest. Work with his staff in the parameters that he allows, because we don't want to put forward something that can't be enforced at the state or local level. So having said that, I'm eagerly listening to Dr. Smith, and I'm here to listen as long as it takes. Commissioner Hawkins, you had mentioned that you put a time limit. I think we need to work this out regardless of whatever the time limit is. So I would reject any arbitrary cutoff of this meeting just for the sake of time. That's all.
Thank you. Colleen, would you please enlighten us as to who all is attending on the computer?
Yeah, we have Barbara Fleshauer, Danielle Walker, Emily Muzzarelli, John Williams, Perry DeChristopher, Rodney Piles, and Sean.
Okay. Now, I'd like to begin then and allow our representatives from our varying municipalities to speak to this, add their thoughts. I don't see anybody from the town of Blacksville. We're going in alphabetical order here. So Granville would be up first there.
I guess my first question would be, if you're setting the number at 3, is that, I mean, you're talking maybe Al's Pizza versus Walmart or Sam's. I mean, is that a fair perimeter to set?
Dr. Smith?
That number comes from the CDC in order to establish what's considered an outbreak. And I understand your concerns that if I woke up and only went to one place today and then contracted COVID-19, can I tag that particular business with that? What we are seeing is patterns of people's social interactions, and it's probably the most observable when we look at the young people, this 18 through 29-year-old group, is they start at one bar, move to the next bar, and move to the next bar. And so what we identify is that this circle of friends, when we ask them how many people were you with, well, I was with my 3 friends. And they failed to see that was 3 friends in a room of 200 people. And so we have to draw the line somewhere. And so the identification of an environment, as loose or as constricted as that may be, is a point to where things begin. And this is a common approach for epidemiology and disease investigation since
Are we
forever.
only talking about bars and restaurants? We're not talking about other businesses?
All businesses.
All businesses.
All businesses.
All
We're
business.
probably going to have to separate the issues. You're right. I think we need
I
to.
mean, yeah, because I mean, you're talking big box stores versus a small store. I just, you know, I don't know. Do you understand what I'm saying?
Oh, no, we understand. That's one of the issues we have to look
that-
at. You're
I
right.
think that would be,
Can it be differentiated, Dr. Smith?
yeah, maybe by square feet or.
Can it be
you know.
differentiated, Dr.
By
Smith?
size of employees.
I would suggest that our disease investigation that we've worked through so far, the 500 that we've done, is that we see very little big box store as the site of involvement. It is usually the more intimate surroundings with people. It's not wide open spaces. It's that failure to observe social distancing environment.
And would our municipalities be involved in enforcing this some way?
That's a great question.
This is a good question because
That's the-
discussions that may lead here, will there be masking in businesses required and mandated? Then that may really involve the municipalities in some code of enforcement in a way, okay? And that's to be decided here, and I will take your thoughts on that.
I really don't know any police department that has enough staff to cover
We
every business
we
in their
understand that, but what I'm
municipality.
saying.
I have a suggestion that I've shown that we could look at as a possibility of how to do that.
Okay.
Okay, but that's a great question. That's what
Yes.
our concern is.
Okay. Any other? Okay, I'll move on to Morgantown next.
Well, thank you for having us, and thank you for hosting this meeting, and thank you to Dr. Smith. Morgantown also has called a meeting, Morgantown City Council, for tomorrow morning at 7:30 a.m. and has invited Dr. Smith to that as well, and we appreciate your participation. I appreciate the questions that were just asked. I think those are great questions that come to mind here as well. I will say that City Council is considering, I expect that City Council will consider tomorrow a mask penalty. I know my understanding is that the university has implemented one for campus, and with a $250 misdemeanor penalty for lack of enforcement. No?
I can clarify.
All right, I
I'll
don't mean to speak for you.
we'll get
So
to that.
anyways, we're considering such a measure as well. In addition to that, I expect that one of the things that we'll discuss is the size of gathering, and the restrictions on the size of gatherings. And so those are additional measures that we are considering. However, I think that the approach that has been proposed by Dr. Smith seems like a very reasonable approach based on science, and I think that, I cannot speak for council as a whole, but I certainly think that that sounds like a reasonable approach generally.
Thank you.
Star City.
I also want to thank everybody, Dr. Smith and the commissioners for holding this and everyone showing up. You know, we're small. My big thing is, you know, I'm a nibber, and, you know, we go to Giant Eagle, my wife goes in, mask, gloves, everything. Now I sit in the parking lot. Giant Eagle's gotten a lot better with masks. Now Lowe's, that's a whole different story. I mean, there's hundreds of people in there with no mask. I can't see why Lowe's can't just say, hey, you have to have a mask. You know, as far as police enforcement, I would say, okay, I work at Lowe's, I ask you to put a mask on, you don't, then you call the police. I think 99% of people will put a mask on once they're told. But I've seen a lot of people are just ignorant. They will not wear it. But we're doing good in Star City. I really think we are.
What's Dip?
I just do have one question for Dr. Smith. You said that the governor made Morgantown a hotspot. You did mean Mon County.
I did.
Oh,
Thank you.
sorry,
I
sorry.
misspoke. Thank you for pointing that out.
Patty had great questions. I had the same ones. I think
But there's a nuance in there. So Monongalia County has been called out by the governor. Under the Division of Epidemiology, Morgantown has been considered an outbreak. So that I probably confused those two in my mind there.
Okay. WVU.
So just to clarify the first point, we
Sure.
have announced a number of enforcement mechanisms going forward and a number of remedial measures. Let me just hit those quickly because I think it'll try, I won't
Please.
meander, but just for some context for my comments on substance. We are requiring every faculty member, staff member, and student as they come back to campus starting July 20th to get a live virus test, and we are providing it to them at no cost, and the university is footing those bills for that at the moment. While we're hopeful that we get some additional relief from Congress or perhaps from the state at some point in time, just that initial test itself for those 38,000, 39,000 tests we're going to be running is in excess of $4 million. If anyone refuses to take the live virus test, we're fining them $250. And then additionally, the employees are prohibited from coming to work if they don't get the test by that point in time, and they'll either be docked annual leave while they're at home, and if they have no annual leave, they'll be docked unpaid. If a student refuses to take a test, in addition to the $250 fine, they'll be referred to student conduct, where depending on their record, they could get a warning, a suspension, or ultimately an expulsion. As it relates to mask wearing, the university has procured 16,000 gaiters, 40,000 of what I'm wearing today, the cloth masks, and additionally we've procured 400,000 of the masks that Dr. Smith is wearing, which we are distributing to all of our buildings, putting in all of our vending machines for free for our faculty, staff, and students to wear. If an employee refuses to wear a mask, their first is a warning to the file, their second is a week suspension, and third is termination. Any student who refuses to wear a mask will be referred to student conduct, where it'll be a similar escalation of warning, suspension, and expulsion. So we are taking measures to make sure that on our campus we are working hard to make sure that we slow the spread of this until we can get to additional therapeutics or a vaccine. We have reduced our classroom size to 50%, and a significant portion, I think it's around 30% of our courses, will be online where we cannot effectively social distance in the classroom. Just a couple more quick things. For our classrooms, for our faculty members who are speaking, we have over 400 classrooms, and we've ordered plexiglass, 6 foot by 8 foot plexiglass will be on rollers that the faculty member can roll in front of them, so that when they're speaking, in addition to the mask, that it will catch any spread that goes out from their mouth, because we've seen in close quarters that we can do that. Our football team and our athletic programs have done all they can to be outside and in. As an example of that, we moved our weight room outside. At the direction and suggestion of Dr. Smith, Dr. Coben, and Dr. Marsh, one of the things we've been advised is that it's always better outside than in, and when you have space amongst you in masks, it really helps. And so again, football players are not only social distanced, but they're actually outside. The weight room is actually underneath the football stadium right now, outdoors to do that. So we are really working hard because we know for our Monongalia County community that the university needs to step up as we work through this pandemic. And we will do additional measures for mitigation going forward. We share the county commission's opinion that we do not want to shut down. We do not want to go into another lockdown. That means for us, if our kids are on campus, that we're going to be dealing with this pandemic. And just like we've taken additional remedial measures, we really appreciate everybody stepping up and taking additional remedial measures moving forward. Just a couple of comments in addition to what everyone else has said. We do think there's a difference between a bar where it's hard to wear a mask, where you're having a cocktail, or where you are in close quarters of 2 or 3 deep in a big box store. And so we think that we need to now, in addition to what the governor's done with the executive order, support additional remedial measures that's going to slow the spread and get us out of being red and into an orange or a yellow spot. We think a scalpel as opposed to a butcher's knife is much better in terms of how we're dealing with this, because we do want to have an economy, and certainly from a university perspective, we will have positive cases. To that point, we've got Arnold Hall where we'll have 170 beds for when someone tests positive, we can isolate them from our community going forward. So, I think that the time is now to act and take some really aggressive measures. We think and we know some of the bar owners in town have already done it. They're going carry out only. They're doing some of those things proactively. We think for the bars in particular, it's going to be challenging, and we've heard this from our faculty, we've heard this from our parents, and we've heard this from our students, that if we don't get ahead of this now, over the next several weeks, it's going to make for a really difficult fall. And so I would encourage the commission, as it's working with the governor's office and municipalities, of, we don't want to shut down restaurants. We understand that, so things for social distancing and limited occupancy. And again, we really think that some short-term, just like the university had, we lost some money we lost a lot of summer programming we couldn't do. We think particularly for those businesses where you're in a close quarter indoors, where it's really not sustainable to wear a mask, that over the next several weeks, we take some really strong remedial measures that allows us to stop this. We can do this solving together without killing our economy, but I would urge the commission, particularly with respect to those small indoor businesses where masks are not feasible for what's going on there, to really think about supporting governor's efforts to put the hammer on that specific point for as little time as we possibly can until we get ahead of this outbreak. So I really appreciate the work and the thoughtfulness of Dr. Smith. I will tell you that I see him 3 times a week, and his help has been invaluable in working with the community from a WVU perspective. So I'm sorry for taking a little bit longer, but I wanted
That's
to...
okay.
I think it's important that the community, given the spread is among younger students, I want the community and all of our elected leaders to know that the university is doing a lot to prepare for the fall to try to slow this spread. So
Chris, I think we're reaching an evolutionary consensus here as to as what we're developing. Is there anybody, I know that Mon Health is represented, is there anybody from WVU Health represented here? Michelle, if you would just care to speak on behalf of both health systems as to what we find, I want everybody to understand our health systems are safe.
Yes.
So if you would, please.
Sure. Yeah. Thank you for having me, Michelle Hopkins with Mon Health System. As a regional healthcare system provider in the area, it's really important and vital for our communities to understand that it's still very important for people to seek care for their emergencies. Heart attacks aren't going away. Strokes aren't going away. Bumps, bruises, breaks aren't going away. Gallbladder attacks aren't going away. So our hospitals have put a lot of safety precautions in place so our communities feel safe to continue to seek their medical care.
Thank you. I'm certain Rob, that
So if you
WVU
would like,
medicine?
I got an update this morning from
Yes,
someone
please.
that's fairly close to the WVU hospital.
Please.
And I would be happy to.
Please do so.
To provide an update. I think consistent with what we just heard from Mon Health, that we continue to watch rates of hospitalization, ICU numbers. So the good news is all the great work that everybody's done to date, we still have a really low incidence of hospitalizations and ICU levels. We are starting to see those uptick, and so if you look at the percentage of uptick, it's big, but if you look at the small base where you're going from 6 ICU beds to 8 across the state, it's a big increased percentage. But to the point of, when you look at Florida or Texas or some of those other states, the incidence of hospitalization in West Virginia, we haven't seen the spike. Now, it's a leading indicator. 3 weeks from now, we'll see if that's still the case. WVU's hospital system, WVU medicine team is working hard and watching those moving forward and prepared if there are additional spikes. But it's the more we can stop it on the front end, the more we'll protect from those lagging indicators of overwhelming the health system. There's, again, I'll stop rambling. They're seeing a slight uptick at this point. Again, lagging indicators 3 weeks from now, we'll see where that number is.
Thank you. I just want to make sure that the community is aware of our hospitals and their contribution, in this area. So I don't see that either Senator Beach or Senator Clements is present. We will now go to comment. Evan, I see you be the only person that's actually in attendance. Your input, and the input, of course, is on the question before us right now.
I'm Evan Hansen, one of the 5 delegates. The other 4, I believe, are on the line, so they may want to speak. We appreciate all that you're doing, trying to work something out that will help slow the spread, and we remain ready to work with you so we can speak with one voice.
Appreciate it. What's really appreciated here is that these are the individuals at the state level. If they have any influence whatsoever on our predicament here, we expect them and hope that they will be using it. If you could go, Colleen, if you could go down through our other delegates, please.
Okay, we'll start with Barbara.
Hello.
Hello, Barbara. You are on. Your thoughts on what you've heard transpire so far, please.
I think I've heard everything. I'm in Charleston. I have a health committee meeting today at 10, so I'll be jumping off a little bit early. And I want to agree with what Evan said. We are willing and able to help. One of the things I plan on doing today is ask questions relating to funding for local public health in particular, and state public health. Dr. Smith, I don't know whether you want to answer this immediately, but I would like to know at some point in time the amount of money you think that you would need in addition to what you're currently receiving from the state, from the county, from grants, and from fees that would allow you to do your job the way it should be done. We have discussed the large cuts that local public health has received over the last 5 years, and I want to thank you and your staff for the good job you've done operating at 75% level. But there is money that has been received by the state to deal with this, and we would like to know how we can be helpful in getting that appropriated to allow you to do your job.
I think that is excellent. I think Dr. Smith could go ahead and put together a proposal to be submitted to you as well as our other delegates to see what we can do. It was this commission's hope that we would be able to meet with state officials, DHHR and others, that we would be able to discuss with them the fact that it does seem that our health department has, in some regard, been bypassed by what goes on at the state level. We don't want. We have 2 great health systems here, plus our health department we don't want them to be ignored. So would you be able to do that for Delegate Fleischauer?
Absolutely. I just want to say that instead of me coming up with the back of the envelope scratch, I will get our business manager, Anthony DeFelice, to put together an accurate and up-to-date answer to your questions. And thank you very much.
All right, thank you.
Just let me add on. I think that, the cut that we experienced, it's been $17 million over the past 5 years. It is at the state public health, which was working with one hot hand tied behind its back, as well as local public health. And my guess is people at the state public health aren't going to be very forthcoming. So if you could provide that estimate for both levels, that would be very helpful.
Okay. Thank you. Who's next?
Danielle.
Danielle? Can you hear us?
Morning, everyone. Can you hear me?
Yes.
Mm-hmm. Your thoughts on our discussion, please.
Today, as I was registering folks for both days of testing, and I didn't want to be a carrier to any of you guys. And I agree with my colleagues. We are willing to work with each and every one of you. I do have a couple of questions, so I will keep that and hold that to the public section,
Okay.
if that is okay.
Sure.
I know these are dire times. I hope that folks are completing that online contact tracing course, Dr. Smith, because I think that is the most important, testing and contact tracing. So please let us know how we can assist in any kind of way to us, to make sure that we are keeping Monongalia safe and putting West Virginians first. Thank you, guys.
Thank you.
Thank you.
Next.
John.
John? John, you're on.
Good morning, everyone.
Good morning.
Thank you to the commissioners for organizing this. I'll be brief. My opinions on this matter, I would say that as policymakers, we are all confronted with ancillary issues of which we have no particular expertise in. I think that happens somewhat frequently, and so we rely upon folks who do have expertise. And I would say that this pandemic is sort of the king of all of those issues as a time for policymakers to rely upon the experts. And so to the extent that I would have recommendations, it would be to really strongly listen to what Dr. Smith has to say in terms of what he deems important in terms of quelching this pandemic. The only thing that I do think is vital, and I hope that Dr. Smith would agree, is that we need to find some way to increase the mask wearing that's occurring in businesses. And if we do have to put some teeth into that, so to speak, then I think that's quite necessary. And I'm open to contributing to that discussion, and I look forward to having that discussion. Thank you all again.
Thank you. Rodney? Are you there, Rodney? Delegate Piles?
Rodney, you're self-muted. You'll have to unmute yourself in order for people to hear you.
And this is why I have somebody else always in charge of this, just so you know, okay? Okay.
We can come back.
We can come back if Rodney unmutes himself.
He's unmuted himself.
Okay.
All right.
He's unmuted himself.
Okay, Rodney, your thoughts? Delegate Piles, your thoughts?
Going once.
Okay. I think, from what I'm gathering here, there seems to be a consensus on closed areas that would be able to possibly be shut down for a period of time. I hear that it is about mask being worn indoors. I'm not sure that it's a consensus, but as well as penalty for refusal, both business and personal. I think these are the items that Mayor Morgantown brought up that I find, and I believe this to be, that if there's no penalty, compliance is really going to be cut down a lot. Now, somebody may say, well, and I've read that people with asthma or this, a shield can be worn, a face covering. So could I have thoughts upon this? In other words, is there, Commissioner Bloom, I know you had a proposal that I believe is from another county.
It's actually from Washington State, and I sent it to the people on the computer. I'd like to hand this out. Again, this is only a draft, but the key is it's a draft to the governor. Because what Lee Smith has done is excellent, and I think we have to separate what Lee has done, which is something we are able to do immediately, which is we can put that in the place if we're all in agreement. So that would be part one. And I really appreciate he used the right word. Embellish would be part two of this discussion, which would be if the governor is working with us, and I know he is, and I want to make it real clear. He could have gone forward, but he did say that he wanted to work with us. This is from Washington, and what I like about it is it's a procedure. Patty has asked the great questions. How do we go through the process? And there's three parts. It's an explanation of how the businesses deal with it. The second part is how we deal with complaints. And then the third is not part of theirs, but it's something I threw out as an incentive. And I think it's important. I am not, and I think all of us are saying, we want the business to survive. We don't want to punish them. So there needs to be an incentive for the businesses to do this. And the key question is, how do we stop people from going in and walking around, and I don't want to pick the company that we mentioned, but let's call Tom's company, that people will not wear masks. We need to stop it at the beginning, at the door. And I can tell you, John Eagle started, IHOP started doing it. Actually, I will say IHOP has it so you can't take off your mask except when you're eating and drinking. So there's some different parameters. Here's a way and a method that's positive, that is working, but the governor must support it. So I want to throw this out. Now, that's part one. Part two of it is the complaint of an anonymous complaint would be going, this is Patty, your answer, to the county health department. Now, what that does is then we need to somehow fund the health department in some way to do that. And again, I will throw out to Sean and Ed and we'll talk about, we have some funding that maybe we need to provide to specifically do this, okay? And then, as you said, I said nearly 500. Actually, it should, the word nearly doesn't need to be in there. The first time would be a warning, then there'd be a first-time offense, and then an offense after that. Then the final thing is the most controversial, which was, of course, individuals not following may be subject to a misdemeanor charge with a fine up to $250. That's not our goal. Our number one goal is to keep the businesses going, and I believe if we do something like this and the governor supports it, within 1 week, I believe 90% of our problem will be resolved. I think it's already starting that. Now, the final incentive, people are probably going to get upset with, but there needs to be an incentive of why the businesses would do that. And what my recommendation would be is to go that if, and this would be something we as a group would decide on, if there was specifically the spike stopped and we started to level off and, do the right thing, then we could be permitted to ask for a 66 to 70, I don't know what that number is. And you say, well, what's the difference? That extra amount would not only pay for that person there, but could also entice the businesses to do this. So again, it's down to the business management, and that's what I would hope that we're doing. This is an idea. This is just, it can be thrown apart, but at least it shows a step-by-step process and a fair method. And I'll throw it out to everyone. And then I have a part three of it, which is about the school system, which I think is a real easy, positive thing we can do. So let's stick with this, and I'll throw this out to anyone. Dr. Smith, is there anything that you want to?
Let's hear. We don't have this in front of Perry.
Yes, she does.
You do?
I sent it to her already. Yep.
Okay, good.
Yeah, go ahead. That'd be
acting
great.
as legal counsel for us here, okay, is our prosecuting attorney. First of all, anything that we would enact or ask for must be able to be substantiated in a legal fashion. So I would ask for her to be unmuted, and any comment that she has, please.
So I emailed back to Tom when he sent me this. The first thing that steps out at me is in the customer complaints paragraph where it lists that it could carry a penalty of nearly $500 for the first offense. And so that needs to be tweaked because the nearly needs to be removed and the could carry a penalty needs to be removed, because if this is a governor's order, there actually is a requirement for law enforcement to enforce governor's orders, and the violation of those orders would already be an obstructing under the West Virginia Code. So I guess my concern is if we're choosing different penalties than is listed already in the obstructing code, I think it's fine, but it certainly needs to be put in there specifically and appropriately. Also, if this in fact is a governor's order, it needs to say that these will be the penalties, that you will be fined up to $500 or fined up to $1,000. And so, because it's going to be police officers that are going to end up enforcing these, to be honest with you, because most folks are going to put a mask on when requested, but I always think in worst case scenario, there are going to be people that are not going to want to put on masks and not going to want to leave. And so the penalties need to be laid out very clearly as to what will happen.
Okay.
And so that's what the governor has been really reluctant to say.
Right.
I mean,
Yes.
he's issuing executive orders, which are actually, it's a misdemeanor for a police officer not to enforce an executive order, but then he says, don't enforce this order.
Right.
And so if, in fact, he issues this as a governor's executive order, it needs to be clear that these are the penalties and we're going to enforce it.
Okay, thank you. We do have a sheriff here. Would you care to come forward or from your chair and elucidate your opinion upon what we're discussing?
Yeah, the only thing I'll say about that is pretty much agree with Perry Joe on that. The fact, I think it should be incumbent upon the businesses to make sure that person doesn't enter the business without a mask on, therefore not letting them in at all. Then if they fail to leave the premises, then to call law enforcement to have them.
And that's all.
Okay, thank you.
I mean, and I understand what the mayor said also, as far as police being busy in this county. It is and I understand that this is extraordinary times and we'll do what we can, but I think that would be the first step. But if the businesses don't enforce that and let the people come in, whether they have to have safeguards by having people out front waiting until this clears, then that's what they need to do.
Okay. Discussion among the principals of Granville, Morgantown, Star City, Westover, and WVU. Is this presentation that's put forth in front of you something that you feel you could support? If so, yes or no, or why? Why not? We'll begin with Granville.
Of course, as Mayor Morgantown said, I can't speak for our council.
We understand.
But I do believe that our elected body would absolutely support this.
Okay.
Because we've seen a lot of customers in the big box stores who just refuse to wear a mask.
Yes.
So if the box stores have an order to follow from the governor with a penalty, I think it does put a little more emphasis on that.
Thank you. Morgantown?
Yeah, I agree. And in fact, I think that Dr. Smith's original proposal will take care of a lot of the other things, right? Because that's going to provide, that's the big stick, right? So if businesses don't comply, then they're putting themselves at risk. And so I think that's really critical. I think that this all seems very agreeable and reasonable. I would say, Mr. Bloom, that if anything, I wonder about the incentive, the last part of this, to increase occupancy. And I think to the answer why would the businesses do this without the incentive? The incentive is to be able to stay open.
Yes.
And that's fine, and we may not, and that may be something down the road, and that's fine with me.
Right.
I just threw it out, I just don't want it to look like we are punishing the businesses. We're doing the opposite, like you said. If this isn't done, businesses are gonna be closed. Okay.
Yes.
Right.
Okay.
You're right.
Star
And that's
City?
fine.
I'm good with all of it.
Okay, good.
100%.
City Westhever?
Just like Patty, I can't speak for the entire council, but I don't think there'll be a problem with it. Our city attorney is here. I'll be interested if he has any extra comments at the
Okay,
end.
please?
Could we amend the rules to allow?
No, I'll allow him.
Sure.
Yes.
Just your initial opinion.
My initial opinion is I agree with Perry Joe that we've got to be precise about the sanctions and
Yes.
not tentative. Other
Okay.
than that, I defer to Steve and the Westover Council for their review.
Okay, thank you.
And thank you. And WVU?
I think it's a very thoughtful approach. I think the one thing that we would need to discuss, so the data indicates that our county, if you look at any metrics, is at a higher risk level than some other counties in West Virginia. And so, you know, as we've talked about within our county, you know, different steps of not shutdowns, I think one question that the governor's office may have is, well, should this be effective for all counties, or if you have
No.
a county where there are,
Yeah.
you know, I know Harvard has something on the pandemic of green, yellow, orange,
Right.
red. And we
Pilot
went
project.
Yellow to red. And so
I think more than a pilot project, it's obvious that we have been singled out.
Yeah.
If we're being singled out to be specifically dealt with, then I think then we should be able to present this to singly be applied to this county.
Agreed, but instead of saying, well, just Mon County, if any county where.
Oh, I see what you're saying. Where there's a spike.
Every county has to enforce this day one.
Yeah.
Once a county goes to whatever the metric that.
I see what you're saying.
Dr. Smith or Dr. Marsh recommends for the governor on one of those metrics of once you go from the yellow to orange or orange to red, these rules will become applicable. It may give the governor's office another tool to say.
Okay.
A way to deal with it, yes.
deal with
Okay.
it. So it's not
That's-
singling out us, but once you cross this threshold.
This is what-
You know, this is the rules you have to do to get back under control.
But
That makes
certainly,
more sense.
I think it certainly could be added as a suggestion
Yeah.
to what we're doing. So I'm hearing a consensus that, yes, Patty?
Is it inappropriate for me to ask a question?
No.
No.
Okay.
No.
Yeah.
And I had a resident ask me
Okay.
this. So if, you know, Monongalia County is a huge employer, and we have people coming from Marion County, Preston County, Harrison County that work here. If they get tested here and they test positive, are those adding to Monongalia County
No,
numbers?
they add to the
They're
other.
not.
Dr.
No.
Smith, you want to explain? That's
Okay.
one of the confusions of the numbers.
That's a great question. And so let's take the testing that was done Friday and Saturday. Many people that work here in Morgantown live in Preston County and vice versa. And so it's basically your home address is the person who gets the list that you're positive.
Okay.
Now that is a little variable in looking at WVU students because their home address may be where the parent's residence is, but 8-9 months out of the year they may be in Morgantown, in which case we want to know that. Okay, so a little variation on that, but we usually look at your driver's license to make the delineation of who gets the positive case, if that makes sense.
Okay, thank you. Okay, I'm hearing a consensus here.
Ed, I'd like the opportunity to pipe in.
Yeah, go ahead, Sean.
Yes.
So we've heard some suggestions. I'm all about the actual process of making something falling through the process. One, I'd like to hear Dr. Smith's opinion in regards to the changes that were, or the additional guidance that we'd like to give to the governor's office to put out as an executive order. And two, I look at this as two different things. Barry, when you're talking about the penalties, I think we're talking about the individuals that refuse. And then on Dr. Smith's side, he's trying to manage the actual entities. And I was wondering if he could, if there was a process by which you're aware of the cases when they happen, and you have your three incidents, and then your three strikes plan that you mentioned. Is there a ability for you to maybe also add, if people complain about businesses that are not enforcing that, to take those complaints into account and have some sort of, okay, you've gotten 3 complaints, we're going to have to shut you down, or if you can validate those complaints, how that would work. That's kind of the way your sanitarians currently work in regards to restaurants. You get a complaint about a restaurant, you send your sanitarians out. Now, you can't go out and investigate every time someone says that somebody wasn't wearing a mask in a certain vicinity, but is there any way that you could take accumulation of those complaints and then have some action that you may want to enforce? So I'm throwing a lot at you. So one, I want your opinion on what everybody's put forth so far and how we can actually reduce that to writing to get something that we can get to the governor. And then the second part of that is actually trying to give the businesses an incentive, because there would be a penalty if they just keep letting people in. People will call and complain, and they'll kind of act as your sanitary officers for you. And if there's a way to incorporate some model of that into your plans.
Dr. Smith?
Thank you. Great question, Sean. I believe wholeheartedly that the consensus that I too am hearing today adds to the not only just the agreement that people have, but the positive nature of helping us enforce this moving forward. We don't enforce a lot of laws. We enforce a little small segment of public health laws, but we will be reliant upon law enforcement. And our efforts here is not to burden anybody. I think that this graduated approach brings those people who will be compliant into line, and if we all work together, I think that we can have a very positive impact and get out of the red seat and back to a more let's just say a better environment. I do agree that the folks in Charleston have been looking for a formula that can be applied in various locations, in various situations, and I think that we have been the tip of the spear here in the last couple of weeks, and this is an opportunity for us to put forward something that may be useful in other environments. And then I agree with your question and concern about the complaints that come in, and we do have currently, both through email and telephone, the ability for people to make comments and suggestions and complaints about various businesses. But I think that the key is that we validate those. And so to your last question was if there was a model, and yes, I think that there is, because in prior to my coming into office, if you will, at the health department, there were concerns and wars fought over the Clean Indoor Air Act. And so our environmental sanitarians did go and do go even yet to various establishments to ensure and enforce the non-indoor smoking regulations that there are. And so this, although not identical, is somewhat parallel, and so we do have the experience with those things. And so it is a matter of validating these complaints, and we typically, upon hearing or reading one of them, will send someone out into the field to substantiate, or at least, let the management know that this is an issue that's being voiced and that, we are watching, and again, work with the proprietors and the businesses to, if this is an issue, or if it's a continual issue, then we're going to be taking a long, hard look at you. And so I think that this embellishment, to use the word, is fine. And with Prosecuting Attorney Christopher's amendments to this, I think that too is fine. I may just add another bullet point that the health department will be validating the various complaints before, taking action.
Oh, yes, that is key.
Yes.
Mr. President,
I have a process question in regards to the governor's executive order. His order calls for masks indoors where social distancing cannot be enforced. Is that correct?
That's correct.
So if you were to be say you're in a box store, if you didn't have your mask on, but social distancing can be enforced, does that language need to be cleaned up? Because you're walking on and out, you're the only person in and out, there's no one within, 6 to 12 feet of you. Is that person within his rights to not have his mask on at that moment?
If I could just say, my suggestion is you wear a mask the entire time. It's just very simple. I know, that's my suggestion.
Clarify the governor's order.
I know.
The order itself
He doesn't know his own law.
Or am I reading into the, am I reading something that's not defined in the order?
Well, I think the order, we're speaking about something that we wish to have proposed. So that would be perhaps a definitive of this order, allowing a process to be followed, and keeping in mind, too, the governor will be speaking at 12:30. Now, that's sort of why I wanted to make sure we had...
have an executive order that exists. I'm asking Dr. Smith's interpretation.
Okay.
Well, Sean, I would just say to that, and specifically to those talking heads and news media pundits and others who challenge the science behind wearing masks, is that in both hospitals there are units where COVID patients are admitted. And the individuals that take care of them, the doctors, the nurses, the aides, the other staff that are in and out of these COVID units, don't get the option of not wearing a mask because I can observe social distancing. They have a strict PPE, and there's no magic to it. It's a gown, it's gloves, it's an eye shield, and it's a mask. And that's the same PPE that we use when we go into harm's way to swab people. And so use of masks is the primary defense that we have when you cannot do the social distancing. So if you truly had a 6-foot bubble around you and it was never interfered with whenever you went to this store or that store or bumped into somebody or two people in the same aisle, that would be fine, but that's not the reality. And so we know what works. We want to get as much compliance with the mask wearing. I believe that it should be, in part, the proprietor and the business owner to say, no shirt, no shoes, no service. Let's add no mask, no come in. And so that would be, I hope that answers your question. We could maybe tidy up the language here a little bit, but I, in essence, would like to see the mask wearing whenever you can't. And so maybe the definition of what social distancing needs to be clarified. So if you're in the great outdoors and you can do it that way. But if you're indoors, your opportunity to violate social distancing is all around you.
Perry Jo, if you would unmute her, please. She has a comment.
Well, Dr. Smith, again, we're two separate things here. We're trying to put something forward to the governor's office that they can enforce that would help us with Mon County. But my question, I'm going to defer to you every comment in regards to what's best and how we should handle it. I just think the existing language that they put out, we should also put a suggestion to them to clarify or correct the language they put out, that it shouldn't add that caveat, because that's what people are reading into. And we just need to be clear. If he wants us to wear masks inside at all times, then the executive order should say that.
You can't see it, Sean, but everybody is nodding in accord here, okay? So with that being duly noted, unmute Perry Jo, if you would, please.
Perry is unmuted. She self-muted.
Okay.
So I just wanted to say that the problem with the last order that the governor issued was that he said it wasn't going to be enforced. And so we have that order out there with those requirements, but when the governor says it's not going to be enforced, it becomes problematic to then try to enforce it, which is why no one has. And so if in fact he's going to issue another order, maybe he can reiterate that his previous order will be enforced.
While you're on the line, will you have the time, again, we do have a slight constraint since the governor is meeting at 12:30. Will you have the time to work with Dr. Smith to firm this up to be able to be sent to the governor this morning?
I don't see it.
Sure, absolutely.
Okay.
And I also just want to say, and
Thank you.
although Dr. Smith absolutely knows this, other folks in the room may understand that our West Virginia code, particularly 16-2-15, allows for criminal penalties for folks that do not follow orders of the health department. And so that already exists.
Good.
I mean, when Dr. Smith issues an order, it comes with misdemeanor offenses for an individual that does not follow it. It suggests that a person is guilty of a misdemeanor and fined not less than $200 and not more than $1,000. And so that already has the full force of enforcement by law enforcement.
Thank you. Yes.
I did want to, I was remiss, Mr. President, not giving you Mayor Johnson's regards. He's recovered from a pretty severe heart attack, which is why he's not here today. But his concern, and I think Westover Council's concern, is about the deployment of our police officers. So I want to be clear here that with regard to the enforcement protocol, the health department is enforcing against non-compliant businesses. The local police department are enforcing trespass complaints from those non-compliant businesses.
Yes.
Our officers are not enforcing a mask law. So I think that's number one point. The second point is, and it's to Perry Jo's, and I think a lot of other people have said this, you know, I don't know if you're aware, lawyers make a business out of finding ambiguity, so we need to reduce all the ambiguity in this protocol. And the key one, I think, is for this commission and the governor to say that social distancing is not possible indoors.
Right.
So that we're not in that debate about, I'm 6 feet away from everybody in Walmart, because as Commissioner Bloom says, turn the corner and you're in trouble. So I think that's a key part of this program.
Sure.
We're not allowing social distancing exception indoors.
Good. I think we do have, I won't say a vote.
Okay, but there is one curve that I think we need. We're talking about box stores. The question now is, because this is what my phone's already ringing from people watching, how do we deal with bars and restaurants? It's a little bit different than what we're talking about, and I was going to refer to you, Dr. Smith. Can we do it for everyone, or how do you want to look at this? Because I can see people saying, well, you were only talking about the big box stores or Joe Smith's store. What about restaurants and bars? And I want to throw that out for your guidance.
Well, I appreciate the council's delineation that social distancing is not possible indoors and won't be recognized as an exception to the ordinance that we want to put forward.
Yeah.
I think that it's difficult to exercise with a mask. I think it's difficult to eat and drink unless you're poking a hole through your mask. And so there has to be an application of some common sense, which sometimes is not very common, but entering and exiting up to the moment that your mask is removed to perform your exercise or to eat or to drink, I think has to be clearly understood. And I think that the businesses need to help us with the enforcement, that you're not going to allow people in whenever they show up if they're not wearing a mask.
Okay.
And so offering them the mask, I think, is fine. I think that the enforcement needs to be done. I appreciate the delineation that individuals that are in trespass mode would require law enforcement interaction. If it's a business issue and the health, then that's a health department issue. And I think that, like any other rule, whether it's the posted speed limit or whatever, you're going to get the compliance of the majority. And, there will be outliers no matter what we do. And so, in essence, we've got up to 2 weeks to see the positive impact of what we are doing, and if it needs ratcheted at that point in time, hopefully we're allowed to do it and not others in Charleston that say that you had your shot at it and we're going to take it away from you.
Yes.
I'm
sorry, can't see you.
Can't see you, that's right.
So I agree with the sentiment of indoors, but just from a semantics perspective, I think that we've heard some of our, community members say, well, wait, masks, no masks, social distance, no social distance. I think maybe the better way to think about it is, given where we are at this point in time, you need to social distance, you need to particularly social distance indoors, but given the level of community spread, we believe that for the time being, a mask is required indoors at all times, absent eating or drinking or, under the direction of a healthcare professional or something like that, until we get through the spread. So it's not that social distancing doesn't work indoors, but it's, given where we are, we need to add an extra layer of protection because we are indoors of a mask requirement, even if you're 10 feet from someone at a big box store, because within 10 seconds you could be within 2 feet.
Yes, somebody's going to be right on you.
So I just a little bit semantics, but in thinking about where we are and what's required, it's another level of mitigation given what we know about the spread in our community.
Okay. Thank you.
Ron?
Yeah.
Just to follow up, I think that there is some science now that shows that ventilation systems in buildings, and I say this as an architect, can contribute to spread, even when social distancing is observed. So there is some validity, I think, both extra validity to wearing masks indoors.
I think that, quite frankly, we do have a reasonable solution to put forth between Dr. Smith and Perry Jo. Do you have any more comments, Perry Jo?
There we go.
Okay, am I unmuted?
Yes.
As I sit here and think about the governor's order and what the penalty should be, it could certainly be referenced that it would be considered a trespass, which removes the penalty that carries a jail sentence. If you look at the trespass code, which is 61-3B3, it carries a fine of up to $100 and is not jailable. But also know that means a law enforcement officer would write a citation to someone, and then that would be it. That would not be an offense that someone could be taken into custody for.
Yes.
If they issue someone that particular citation for trespassing and the person continues to come back to the store or continues to really obstruct, then that would be a separate law enforcement issue, maybe separate and apart from the governor's order. Because I kind of always sometimes think in worst case scenarios, people saying, yep, give me my citations, then I'm going to go shop. And so it would then be subject to the obstructing, which would then be maybe a penalty that could carry up to some time in jail, and that person may be taken into custody by law enforcement. So I'm thinking that the governor may not want to sign an order that carries jail time particularly.
Right.
That's what I said. Yeah.
But I also think they may want to just reference a code section that already exists, of which the refusal to wear a mask
Well, I would.
Which means, I'm not sure who said, we're not enforcing a mask law, we are enforcing a trespassing. It's the business's job to enforce the mask. We are only enforcing trespassing, which already exists.
I think we're here and hearing the same thing. I think that we can entrust Perry Jo and Dr. Smith to put these together in an order. I'll ask for a straw vote. Is there any objection to this? Hearing none, we will then have Dr. Smith immediately confer with Perry Jo Christopher, and we will then seek an order to be issued on behalf of Monongalia County before the governor's conference at 12:30.
Yeah, that is our goal.
Yes, that's the goal. We are, of course, putting them under under duress, but then Perry Jo says she can do it. I know she can. Okay. That being said,
I have one more recommendation. This is an easy one that I believe everyone will agree, because I see Dr. Campbell in the back. Since we are working on trying to get the students back in school, I have a simple recommendation that I would hope everyone would support, which would be that we would start to ask the parents of all children this week, starting to prepare them by 1 hour a day, wear a mask.
Let's let Dr. Campbell speak. I'm sorry, I didn't have him.
Well, my recommendation is 1 hour a week that they would wear a mask and practice as you would build that up, so when school starts, it isn't thrown all on the school system. So I'll go with you.
Dr. Campbell?
It's part of our concept.
Thank you. I'm Eddie Campbell, Superintendent of Schools here in Monongalia County. I can't tell you how important this conversation is today for the public school children of Monongalia County. I don't know if you realize it or not, but if we start school on September 8th, we will be close to 6 months without having seen our children face to face. We are losing a generation of children because they're not in our schools. We absolutely cannot afford to not have our children back in school in front of our staff come September. One of the biggest concerns we have, I think, is obvious, and I think it's been discussed today, and again, we're very appreciative of that as a school board. The governor really didn't do us any favors by pushing us back 3 weeks. We were very confident that we would be ready to start with our original calendar. I think we have a very well thought out plan of re-entry that would have prepared us and allowed us to start on time. I understand why the decision was made. There's probably a lot of other counties out there that weren't going to be ready or comfortable with a start time, but we weren't one of those. Our biggest concern, obviously, and again, I think it's being addressed today, is that the university students are going to be returning 2-3 weeks before we actually start school. And we're so appreciative of the steps that WVU has taken to try to control their particular situation, which, if that is not under control, is going to directly impact us as a public school system. If things go the wrong direction, we're very confident that the governor could pull the plug on Monongalia County schools. He has stated that this is going to be a county-by-county decision as to whether schools close or stay open. And so it is critical that this county address and control the level of outbreak that we have here. Again, being appreciative of WVU, we also understand that there's a lot of things that they're not going to be able to control. Thinking about small bar drinking establishments that students, WVU students frequent, house parties that WVU students have when they return. Kids that age, they think they're Superman and Superwoman and that nothing impacts them, and we understand that. And so, again, this conversation is so critical to our being able to get our kids back in, because we can't lose this generation of kids. So, again, we appreciate the conversation.
For the public and general knowledge, would you please give us where we might find the re-entry plan?
It's actually posted on our website right now. We've been sharing that for social media. We released that on Friday. I will mention the two pieces that we released. One was a statement about face coverings. And to Mr. Bloom's comment, we appreciate the fact that you're reinforcing that getting our kids used to wearing a mask is going to be important. We have taken the stance as a school system that we intend to require face coverings for all of our students, and that's pre-K through 12, as well as our staff. And we are using the language coverings, and I think that's important that our community know that. It's not necessarily going to be a mask. It can be a shield. It can be a gaiter, whatever the case may be. The other piece to what we released on Friday was the options. We really have to be flexible as a school system. We understand there's lots of parents that aren't going to be comfortable having their kids return at this stage of the game, but we intend to have face-to-face instruction. We intend to provide a virtual option that would allow parents to continue to have their students enrolled in our school system without physically being present in the building. And then there's obviously the option for parents, if they choose to take that stance, that they could homeschool their students on their own. So we're prepared to be flexible with our parents and provide them with options.
Thank you so much.
You're very
Appreciate
welcome.
it.
Appreciate the
Thank you for
information.
coming too.
Now, this meeting is not adjourned. However, those of you who don't want to stay, please, you may feel free to leave. We must have public comment, which we will do, but unless you want to stay and have public comment, I will, of course, tell Dr. Smith I think you should get busy. Okay? So you may please start conferring with our prosecuting attorney. And again, anybody who doesn't want to stay, that's fine.
We could also open it up during the public comment if any of the people on the computer want to say something too at that time.
Perry wants to say something.
What?
Perry J wants to say something.
Sure.
Oh, okay.
No, he's out.
Barry Joe?
I just wanted to say something really quickly.
Sure.
Because I echo Dr. Campbell's comments that folks may not really be understanding the loss of the impact of the teachers and the school system on our kids. And when we say we're losing a generation, our abuse and neglect cases have gone through the roof.
We understand.
Kids that are in jeopardy. Our schools do a really great job of intervening with those kids, of helping those kids, of calling DHHR and getting those kids out of bad situations where no one else would see those situations but for a teacher. And those teachers don't have eyes on those kids right now. No one does. And so we only find those cases when something bad has happened. Our abuse and neglects have gone through the ceiling. Our child pornography has gone through the ceiling. Teachers serve a much more, I don't want to say more important role, but one of the additional roles that they serve are intervening in those situations because they know what to look for and they know what to see and they know how to get something done. And we're losing that right now.
Thank you. Yes.
Perry Joe, Lee Smith here. Do you have my cell phone?
I do.
Call me, because I don't have
Make
yours.
it public so everyone can call.
If you can give me about 10 minutes and then call me, I'd appreciate it, because I looked yesterday and I did not have yours.
Yeah.
And,
I will call the minute I hang up, and I'm hanging up in just a few minutes.
Okay.
Thanks, everybody.
Thank you.
And if I could ask one of you two gentlemen to send to her the draft that I had
She
put
already
in. Okay, I wanted to make sure that she had that.
She already
Yeah,
has.
she had that
All right.
too, yes.
All right,
Okay. Thank you.
I am going to get busy.
Please get busy. Okay?
I just wanted to get a clarification here regarding with the face coverings for inside. How does it relate to like offices? You know, like our office upstairs, it's been good when we had the walkthrough that our staff are more than 6 feet apart for most of the things that if they weren't near one another, they could disengage and mask. So would this change, then we'd have to have the face covering throughout the day?
You are an elected official. You are setting the policy for your individual office.
All right.
Okay?
All right, just wanted to
Thank
make
you.
sure. Thanks.
It's more for interaction in the public area, which is different.
We have control here, all right? But we do not have control in these stores and other areas.
So if I could just quickly, does that bring the point of a private business who has separate offices? So if someone's in their office.
If they're in their office, they're in their office.
We're not impacting
No.
that. We're talking about
Public interaction, and that's the key that we need to explain. It's public and others coming into your business or office. And then each person has the right to control their own office.
Yes.
But yes, exactly. Good point, Rob.
Thank you. Thank you all. We are now open for public comment.
I'm going to start with Danielle.
Yeah, sure. Yeah, let Danielle have some questions.
Please be aware, public comment is limited to 3 minutes. And we will now open public comment. You have 3 minutes to speak.
Thank you. This is Delegate Danielle Walker. Thank
Yes.
you for acknowledging. I do have some questions, and I'm not sure if everyone has left. But with Dr. Smith's plan, is there going to be a time frame of when a business has the first 3 people to the next 3 people to the next 3 people? Is this only going to be ineffective if Governor Justice goes ahead with this order? Or let's say this happens within a 2-month time period. I'm hoping not. I'm hoping that we can buckle down and stop the spread. So that's that question. What is the time limit of all of these strike threes? And then I want to know, how many ventilators do we have in Monongalia County? Two hospitals?
Danielle, not to interrupt, but Dr. Smith has already left to start working on this order, so he can't answer those questions.
Okay.
Okay.
I wish I would have been recognized before everyone left. Thank you.
Sorry.
But to try and answer the one question, his recommendation was separate from the recommendation going to the draft for the governor. He wants to start that, I think, in 2 days.
Are you going to suspend the rules before you respond to it?
Oh, I'm sorry. May I suspend the rules?
As a rule, it's hard to keep you. It's hard to keep you quiet, Tom.
Yes, it
but
is.
You may go ahead and suspend the rules.
Thank
to
you.
Answer the question.
Right. The question is, we were planning to move forward on his recommendation, and it would start clean slate. Like I think in the order was in 48 hours. The other issue is going to the governor, if that helps clarify.
Okay. Thank you. Is there any other comments from the public? Hearing none, I close comments from the public. Do I have a motion to adjourn?
Move to adjourn.
Second. It's been properly moved and second to adjourn. All in favor? Aye. All right, folks, just so that it's noted, we were able to achieve that in only an overage of 11 minutes of the time parameters. So thank you all for coming and attending.